I am Julia Cohen. I am the managing director and a co-founder of Plastic Pollution Coalition. Thank you for joining us to this month's webinar. Topic is global human health and ocean pollution, and we will be having a conversation with Dr. Phil Landrigan. We're so excited and grateful. As you know, we're a coalition, many of you know, that has been growing significantly over the past 11 years. We now have over 1,200 organizations and businesses and thought leaders from 75 countries, all working towards the same goal of a world free of plastic pollution and its toxic impact on humans, animals, waterways, oceans, all that. We will be doing a few poll questions. We will read them out to you, and then you can click and respond. And you can then also, in the Q&A, you can post questions and upvote other people's questions. And we encourage you to share your thoughts and this on our social channels. So the first poll question, just to help Dr. Landrigan also know who everyone is for you to tell us a little bit more about yourself. And it looks like over 70% are concerned citizens, and we have a lot of folks from NGOs, but almost 15% are students. So really appreciate that, and some researchers and teachers, and thank you. Okay, so we'll move on to the next poll question. Where are you joining from? So the majority of you are in North America, which makes sense for the timing of all this. Do have some folks in Asia, Southeast Asia, and Europe, and the Caribbean, and even Africa, so, and South America. Wow. So thank you. And then last but not least, what interested you the most in today's webinar topic? Okay, most of you are all of the above, but it looks like ocean pollution is the overall winner with 41%, human health at 24%, and Dr. Landrigan's reported 18%. But I think for those of you who don't know Dr. Landrigan, you will want to hear him speak in the future whenever you get the opportunity. So thank you so much for participating in the poll questions, and we're gonna move along now to our featured conversation. Dr. Phil Landrigan, who very nicely likes to be referred to as Phil, and we appreciate the informality, is a leading epidemiologist and pediatrician. He is the director of the program for global public health and the common good at Boston College. And he will be discussing the latest findings from his new report, Human Health and Ocean Pollution, and what we can do. So I will be welcoming Dr. Landrigan to make some opening remarks for 10 to 15 minutes. And then we have received a lot of questions submitted ahead of time. And we look forward to your questions, additional questions being submitted now. And I'll help facilitate running through a bunch of those. And throughout all of this, feel free to upvote other questions you see submitted. So without further ado, Phil, please take it away.
Julia, thanks. It's really great to be here, and thanks for putting up my slides. So this is the theme here, that ocean pollution is a big problem, and I'll give some highlights of the bigness of it in just a minute. But the message I really want you to take away from this talk is that ocean pollution can be prevented. It is not inevitable. It is not the unavoidable price of economic progress. And that when ocean pollution, just like other forms, is prevented, there are multiple benefits. It benefits human health, human well-being, psychological health, if you will, and it also has economic benefits. So from 2015 to 2018, I co-chaired a big global commission on pollution and health that was sponsored by The Lancet, which is one of the world's leading medical journals, published out of London. And this is the definition of pollution that we used in that report, which is the definition I'm using tonight, is that it's waste material that is released into the environment by human activity. So it's not, for example, volcanic eruptions. It's stuff that people put into the air, put into the water, dump on the earth, that endangers health and harms ecosystems. And just to give you a sense of how bad pollution can be, that picture in the background, people always ask, where's that from? And the answer is it's from Cleveland, Ohio, in the United States. It's from 1968. And it was taken about 4 blocks away from the hospital in Cleveland, where I was a an intern in that year. And I can recall on some days in the 1960s in Cleveland, the air pollution inside the hospital in this long corridor that we had that ran the length of the hospital was so heavy that you could not see from one end of the hospital to the other. It was really quite amazing. And the air in the States and the air in many countries is far, far better than that now because we've put laws and regulations and policy and enforcement into place over the past 50 years that has gone after the major sources of pollution. And that's the playbook that I'm going to talk about in the end of this little talk that can be applied to the control and the prevention of ocean pollution. It is a preventable problem. So let's talk now, let's have the next slide and talk about ocean pollution. It's widespread, it's worsening, and most importantly, it's complex. Plastic, which is appropriately shown at the top of this little thing here, which we call the pollution berg. Plastic is hugely abundant in the oceans. It's the single most abundant component of ocean pollution. It's also the most visible. It's not the only one. There are also oil spills. There's mercury. There are all sorts of manufactured chemicals. There are pesticides and nutrients, which means fertilizer and agricultural runoff and sewage that comes from the land. A quick word about mercury. The major source of the mercury in the ocean is something that probably most people don't understand, is coal. It has to do with the fact that all coal contains mercury. When coal is burned in power plants and steel mills and other factories, that mercury vaporizes, goes up the stack, goes into the atmosphere, travels on the wind, and eventually comes down in the ocean. And in the ocean, it has the nasty property of concentrating in the food chain so that the mercury levels in the predator fish like tuna at the top of the food chain are very high. And if a pregnant woman eats mercury contaminated tuna, the mercury in the fish will go right through her body, into her baby's body, and can cause brain damage in the baby. So ocean pollution is not something that's just out there over the horizon. It's something that can come back and it can harm human health quite directly. Have the next slide, please. What are the drivers of ocean pollution? Well, the first one is close to the heart of our discussion this evening. It's massive increases in the production of plastic. It's going up logarithmically, exponentially, astronomically. And right now, an estimated 10 to 12 million tons of plastic enters the oceans every year. That's on top of the 150 million or so tons that are already out in the oceans floating around. Second big driver is massive increases in the production of manufactured chemicals, which exactly parallel the production of plastic. And then the third driver is huge development, uncontrolled development along the coastlines of the world. Close to 40% of the world's population now lives within a few miles of the coast, and that percentage of the global population is growing. That puts pressure on the land. It increases coastal discharge. It all increases pollution in coastal waters unless deliberate, intentional action is taken to prevent it. So this is just a little graph illustrating the point I made a few minutes ago about the huge increase in the past half century in the production of plastics from virtually nothing in 1960 to 7 billion, is that pounds or kilograms? Tons, 7 billion at the present time. I think most people know, but perhaps not everyone on this webinar, what's going on with plastic. What we've learned over the past few years is that plastic is the fossil fuel industry's plan B. What do I mean by that? So for many years, the manufacturers of fossil fuel, coal, oil, natural gas, have had their markets in heating, transportation, the production of electricity. Nowadays, with increasing concern about greenhouse gas emissions and air pollution, the market for gasoline for cars, for coal for power plants, for other uses of fossil fuels as a source of combustion is going down. But at the same time, the fossil fuel industry has an absolute glut of product because the production of natural gas, fracked gas, has increased 400% in the United States and by large percentages in other countries. in recent decades. And so the fossil fuel people have enormous amounts of carbon that they want to sell to somebody. And they very cleverly figured out that they could sell it to the people that make plastic. And so that's one of the driving factors behind the increase in plastic reduction. And all of that, therefore, contributes to global climate change, global warming. These are not unrelated problems. They're joined right at the root. The next slide, please, shows the global increase in the production of plastics, exactly the same trend. And again, petrochemicals are the major rootstock for most, for the manufacture of most of these chemicals and pesticides. So what are the key findings of our Commission on Human Health and Ocean Pollution, which is the subject of our report? And by the way, the good folks at the Plastic Pollution Coalition have that report. It's open access and they can make the link available. They'll tell you how they can do that. The commission was sponsored by the Scientific Center of Monaco in the Principality of Monaco in Europe. And it had the blessing of Prince Albert II of Monaco, and we received some financial support from Prince Albert's foundation. The Prince and his foundation are deeply organically concerned about the health of the oceans, going back to his father, who founded the Oceanographic Institute in Monaco and sponsored Jacques Cousteau for many years. And the key findings of this pollution were, number one, that ocean pollution has many harmful effects on marine ecosystems. It destroys coral, it fouls harbors, it pollutes estuaries, which are the nurseries of the sea. It leads to collapses of fish stocks and contamination of shellfish so that they can't be eaten. It has multiple negative effects on human health. I mentioned the mercury already. Plastic is another problem. When plastic gets into the ocean, it breaks down over the decades into microplastic particles, little tiny microscopic particles. I think of these microplastic particles as little floating Trojan horses, because each of them contains in it the backbone plastic and then all the synthetic chemicals that are added to the plastic as it's being manufactured to give it certain properties: brominated flame retardants, PCBs, lead, phthalates, bisphenol A, and scores more. When plastic in the ocean breaks down, it forms microplastic. The microplastic moves into the food chain. It gets into fish and shellfish, carrying with it all of those chemicals I've just mentioned. Those chemicals include carcinogens, neurological toxins, reproductive toxins. And when we eat fish, when we eat shellfish that's contaminated with those materials, all of those chemicals come into us, into our bodies, into our children's bodies. The third point is that ocean pollution is deeply unjust. It is not uniformly distributed around the world. Its impacts fall by far disproportionately heavily on the poor, the vulnerable, the minorities, indigenous people. Think, for example, about coastal communities in Africa who depend upon the sea for 60 or 70 or 80% of their diet. If the ocean is polluted and the fish stocks crash, those people starve. They have nowhere to go. They don't have any other food sources. Or think about the Inuit people in the Canadian Arctic, whose fish is now so heavily contaminated by mercury that they can't eat what had been their staple diet for centuries. The fourth point is that ocean pollution is not well mapped. We know a lot about it, but there's even more we don't know about it. We certainly know enough to take action. The need for further research is never an excuse for delay, but there's still a great deal we don't know. Much of the open ocean, the levels of pollution, once you get away from the coastlines of the world, is mostly simply unknown. And finally, coming back to my key point this evening, that ocean pollution, like all forms of pollution, can be prevented, and prevention is highly beneficial. What's the evidence that pollution can be prevented? Well, I think the proof of principle is in the fact that high income and an increasing number of middle income countries have made superb progress against pollution of the land. And they put together multifaceted strategies that begin with law and policy, and then there's technology, then there's regulation, then there's enforcement. Obviously, the details differ from country to country because they're always wrapped up in a country's legal system, which is clearly different from country to country. But the basic toolbox is the same, and it's well worked out. It's been in place now for more than a half of a century. It's proven highly successful. And our Lancet Commission on Pollution and Health concluded in 2018 that these solutions are ready to be taken to global scale. And they're certainly ready to be taken to global scale in the case of ocean pollution. This is a graph that covers the years 1970 out to 2015. And this lower line, this thing trending down, that's the 70%, 70% decline in air pollution that has taken place in the United States since we passed the Clean Air Act in 1970. It actually bumped up a bit in the last 3 years, but we won't talk about that tonight. But over the last 70, over the last 50 years since 1970, there's been a 70% decline. In the same time, as represented by this green line here going up, the gross domestic product, the economic indicator of America's economy, increased by 250%. So anybody that tells you that controlling pollution is going to kill the economy, is going to cost jobs, is just not speaking the truth. It's an old argument. We've heard it for years. It's simply not true. Pollution actually produces a positive economic return. Pollution control, sorry, produces a positive economic return because it preserves ecosystems, it keeps people from getting sick, it keeps people healthy and productive and contributing to the economy for many more years than would otherwise be the case. So what are the actions that need to be taken to end ocean pollution and protect human health? Most importantly, the root cause of all evil here is the combustion of fossil fuels. And the fundamental thing that we have to do is rapidly transition away from fossil fuels to renewable energy: wind, solar, tidal, geothermal. Not nuclear. I don't think nuclear has any place on the menu, but wind, solar, tidal, and geothermal all have important contributions to make. We can prevent mercury pollution of the oceans by ending the burning of coal. We can end plastic pollution by doing all the things that the Plastic Pollution Coalition is pushing, ending production of single-use plastic, ending plastic bags, getting rid of this stupid plastic wrapping that seems to show up everywhere these days, and just generally reducing the overall manufacture and use of plastic in our society. Waste management and recycling are important. To reduce coastal pollution, we need to reduce agricultural releases from animal waste and so on. Robust monitoring, research, extend pollution control programs, and last but hardly the least, create, expand, and safeguard marine protected areas. Marine protected areas are the national parks or the international parks of the sea. They're places of great natural beauty, places of extraordinary biodiversity, just as we protect Yellowstone and Banff and other beauty spots on the land. The more marine protected areas we can have, the healthier will be the oceans. And the next slide, which I believe is the last slide, I simply want to say thank you. And I want to remind us all that we are the stewards of the earth, especially in this time in history where we now stand, this Anthropocene era, the first time in all of Earth's history where humans have been the dominant species on the planet. We truly hold the earth in our hands. We hold it in trust for our children. Thank you.
Thank you so much, Dr. Landrigan. And I was very remiss, and I actually had a much more detailed introduction of you, and it kind of ties to one of my first questions as well. For those of you who don't know, Dr. Landrigan was one of the, his studies on childhood lead poisoning documented the, IQ loss and the incredibly negative impact of lead, and catalyzed the removal of lead from gasoline, which, as a mother, I'm extremely thankful and grateful for all of your work on behalf of our children. And you've chaired the National Academy of Sciences Committee on Pesticides in Children as well. And your knowledge, your deep knowledge of the chemicals used in plastic and the production of plastic and making plastic see-through, flexible, hard, soft, all those things, we know are, the same chemicals that are being used in a lot of other things and coming from petrochemical industry production. And as you said, they may be the very well like lifeline of those industries to continue to survive in the future by continuing to increase their production of plastic. So I just want to make sure I got all that in here as well. And then, one of the things that I think a few folks have asked about is, in addition to leading the Monaco Commission on Human Health and Ocean Plastic for the last few years that did this incredible, in-depth research report, your new institute at Boston College, if you could just tell us a little bit more about the program for global public health and the common good, and its overall mission, and how your approach is different and what's new about it.
Sure. So Boston College is my alma mater. I have to say that at the beginning. It's where I went to college and graduated many years ago, and then I went on to medical school, and then I worked at the Centers for Disease Control in Atlanta, then at Mount Sinai Medical Center in New York City for many years. But 3 years ago, Boston College invited me to come back to Boston, back home, to stand up a new program in global public health. And after a lot of consideration, we decided that the full and proper name of the program, as you said, Julia, should be the Program for Global Public Health and the Common Good. We put the words common good in to emphasize that anything that we do to improve people's health makes everyone better. It enhances the common good. And because Boston College is a Jesuit Catholic institution with a deep commitment to advancing ethics in society, that name resonates with who the institution is. What we're doing in the program is fundamentally two things. We're training the next generation of leaders in public health. We now have an undergraduate minor. We're hoping within the next year or so to have an undergraduate major, providing people with a bachelor's degree in public health. We also have a research program called the Global Observatory on Pollution and Health, and that was the link to Monaco. We've done a couple of big studies in the last few years. We just, in December, we published with a number of colleagues from India a report documenting the extraordinary toll that air pollution takes in India. Kills 1.65 million people a year. Really unbelievable burden in that very large country. The ocean pollution report. And we're now working, going forward with our concern for the ocean. We're working with a group called the Tetiaroa Society, who are based in French Polynesia, who are concerned with rebalancing the relationship of humanity with the seas for the benefit of both human health and planetary health. Be happy to talk all night about that, but in a few seconds, that's what we're up to.
Wow. Thank you. That all sounds great. And an undergraduate degree in public health is just, well, I'm sure will be very welcomed, especially these days. We have a lot of questions coming in right now, 19 new that have various upvoting, things like that. But maybe just to get started, well, our team kind of sorts through some of those. What specifically are the impacts on the human system and body from the chemicals and from plastic pollution specifically? If you could just talk to that a little bit.
Right. Well, I think it's important to frame the answer to this question by pointing out how complex these exposures are. The microplastic particles that get into the marine food chain and then into all of us when we eat plastic contaminated fish contain all of those different chemicals that I mentioned in the talk that are in plastic: flame retardants, hardeners, softeners, coloring agents, plasticizers like phthalates. And that whole mixture of chemicals, that whole complex mixture, is what gets into us when we eat seafood that's contaminated with plastic. Now people ask, what's the evidence that phthalates or brominated flame retardants that are in a microplastic particle in seafood causes harm to human health? I think the short answer is to say We don't have enough studies at this point to be able to say what is the impact of brominated flame retardant in codfish on human health. But I'm not sure we have to answer that question in a way. We do and we don't. Obviously, more knowledge is better. The reason I give that sort of glib answer is that we already know full well how dangerous brominated flame retardants are, especially if the exposure occurs to an infant in the womb during the 9 months of pregnancy. We know that exposure of babies to brominated flame retardants from any source, seafood or your computer or the couch in your living room, if that stuff gets into a mother's body and passes through to her baby, it will reduce the baby's IQ, it'll shorten the baby's attention span, and as the child grows up, the child will have visible injury to the brain, visible when you do an MRI, that's still there when the child is 9, 10, 11 years old. Well, people that tell you that, well, we don't have to worry about plastics in the ocean because we don't really know that the chemicals in plastics in the ocean cause harm to human health, they're sort of spinning you a tail because we already know full well that these chemicals cause harm to human health, and whether they come by seafood or from some other route hardly matters. Once they're in the body, they are what they are. So to speak for one more minute about what some of those chemicals are, I already mentioned the brominated flame retardants and their impacts on the developing brain of the infant. Phthalates are another class of chemicals. They fall into the category of what's known as endocrine disruptors, meaning that they can interfere with endocrine hormonal signaling in the human body. You know, the cells communicate in the body, communicate with each other by sending chemical messages, which are called hormones. There's thyroid hormone from the thyroid gland. There's adrenaline. There are steroids. There's estrogen. There's androgen. There's many more. And these endocrine disruptors get into the human body and disrupt signaling. It's like hacking somebody's computer. And because the human body is always most vulnerable at the beginning. In other words, the most vulnerable stage in human life is during pregnancy and during the first few years after a child is born. If a child in the womb is exposed to phthalates, we now know from the work of my Mount Sinai colleague, Dr. Shauna Swan, who's got a great book coming out in a few weeks.
And our next webinar next month.
Yeah, right now I'm giving a pitch because she's a friend. And prenatal exposure of a baby boy to phthalates causes abnormalities of the little boy's reproductive organs. Not good. And when that little boy grows up to be a young man, his sperm count is going to be lower than it should be. Not good for the propagation of the species unless we're going to clone women in the future. That was a joke, sorry. These chemicals that are in plastic are not benign chemicals. And we have to, as a society, we really have to wake up to the chemical contamination that's all around us. We have to wake up to the fact that the majority of the chemicals that are in commerce, that are in plastic, that are in household products, that are in your local store, have never, ever been tested for their safety or their toxicity. This is a great failure of our legal and our regulatory system in this country.
Well, so that takes me in a couple different ways, and thank you for that more in-depth kind of explanation of all of it for folks here who've been asking and may not know about that. Two things: we've got a lot of questions about how do we reduce our exposure to toxic, plastics and plastics in our everyday lives, and then also what kind of actions can we take at the local level, at the federal level, at the global level. If you could speak to that, please.
Sure. Well, I think the way to frame this is exactly as you just did, Julia. We have the opportunity to operate at multiple levels. Parents are the CEO in their own home and therefore can control what comes into the home. You can control what you buy, what you bring in, what you expose your kids to, and anything you can do when you go to the store to reduce your purchase of plastics and materials containing plastics is to the good. Bring a cloth bag to the store for starters so that you don't end up with a plastic bag. Avoid products to the extent you can, avoid products that are doubly and triply and quadruply wrapped in plastic. Most of that is wasteful. It's one-time use plastic that immediately goes into the trash or into the recycling. It benefits nobody except the manufacturer of the plastic. At your community level, you can take action to ban plastic bags, to improve waste sorting and recycling, so that this stuff doesn't get dumped anymore. And finally, we all have to step up at the political level, at the city, at the community, at the state, the nation, to do something about this problem. The multinational companies are sitting back, grinding out this plastic, using the natural gas to make ever and more and more and more plastic. It's out of control. It's truly out of control. And it's our children, it's our grandchildren who are going to pay the price. And we all have to become involved at the political level, as indeed the new administration in the US announced even just today that they're going to do. And that's what we've not been doing in this country for the past 4 years, but thankfully we've now turned the corner, and it's what a number of other countries are already doing, and we're very happy in the United States to be back in the game and doing what we should be doing.
Thank you. Yeah. Well, and just to add to that, a couple of specifics that we have more about on our website, as well as the Break Free from Plastic Pollution Act will be reintroduced in late February, early March this year. If you don't know about that, it's federal legislation that goes upstream and addresses a lot of these issues. There's also the Basel Convention on Waste that will put the US back in a global leadership position if we work to sign on to that and add plastic to that. And then obviously there are a lot of local laws and policies. There's some push for opt-in for all the food delivery, to make it automatic that you have to opt in if you want to get those plastic utensils or additional things with that food you're having delivered. Which leads me to, we've got a couple questions about how's the pandemic affecting the situation right now. If you could talk to that, please.
Yeah, well, I think the pandemic has so many effects, and they don't all go in the same direction.
Yeah.
Certainly air pollution, at least earlier in the pandemic, was substantially down. It was down by more than 50% in India, by 40% in Europe and China, by 25% in the US, simply because people were driving less, flying less, just less consumption. On the other hand, the pandemic has triggered enormous amounts of in-home delivery. People are getting stuff at the front door now instead of going to the store to get it, and that means more wrapping of all kinds, including more plastic wrapping, unless there are specific actions taken, like the opt-in, opt-out thing you just mentioned, Julia, to not be getting plastic. The masks are yet another problem. Most of the masks that are commercially available are made entirely or largely out of plastic. A lot of them just get used one time and then tossed. They end up in the trash stream, or the recycling stream, or just in the waterways or beside the street. Some of the most attractive masks out there are not plastic at all. They're the masks that people sew or buy that are made of cloth that can be run through the washing machine and reused. My wife and my daughters have both become very skilled at making these things. They're much better for your face and much better for the environment than plastic masks. I think there may be others, but those are the most obvious consequences of the pandemic that come to mind.
Yeah, I've heard that disposable masks are the new six-pack ring.
Okay.
That the handles of them are actually entanglement issue as well.
Yeah.
And then I think there's also, right, I mean, the overall plastic pollution supply chain is tied to also the health of people who are in positions to have worse COVID impacts as a result, right?
Oh yeah, yeah. So there's some very strong evidence now that the COVID death rate is higher in communities that have higher levels of air pollution. And a lot of those are, in fact, communities that have factories that are producing plastic.
Yeah.
There's even a very strong piece of evidence that says that that's a real relationship and not just some kind of a statistical fluke, is that we have what's called an exposure response relationship, which means the higher the exposure to air pollution, the greater the death rate. It's like a straight line function, which is always strong evidence that this is a real phenomenon. And it makes sense, right? That if people's lungs were already being damaged by fine particulate pollution, and there's already inflammation going on in their lungs and their bronchi and so forth, that when they inhale the virus is going to have fertile soil and can cause a lot of damage.
Thank you. Yeah, I think it's also not only people living in the shadow of the extraction and manufacture and processing, but also folks who live near waste management, right? So there's what
Indeed.
is called or passes for recycling in this country and in the world. A lot of it's incineration,
Yes.
right, which is also a problem.
Which puts out plenty of air pollution, yes, and makes it worse, yeah.
And it's also the water in the soil is being affected by whether it's waste to energy or pyrolysis or these other systems, maybe terms. I think we also have a question too about artificial turf and not only the manufacture and use of it, but even the disposal of it. Maybe you could talk to that a bit.
Sure. So there are various kinds of artificial turf. The earliest generation, going back probably 10 or 12 years now, consisted of ground up truck tires, and which were then ground up into little pellets, and thousands, millions of those pellets were put on a soccer pitch or a football field, and the kids used to come home with the pellets in their hair, on their skin, on their clothing, and their socks, and so on. And people started asking what's in those pellets. Well, there was a whole group of toxic chemicals. The pellets, the rubber itself is almost entirely these days artificial rubber made out of two compounds, styrene and butadiene. Butadiene is a known cause of leukemia and lymphoma, and styrene is a neurological toxin. So the base product, the plastic backbone, is comprised of two very toxic chemicals. And then on top of that, those ground up tires contain all the nasty stuff that they pick up in 2 or 5 or 8 years of rolling along the highways of the world. Everything from lead to zinc, to copper, to dirt, to pesticide residue, and all of that stuff ends up on the playing field and can get into the bodies of the children and the young adults that play. Another problem with those fields is that they become tremendously hot during the summer months. Temperatures of 140 degrees Fahrenheit, which is roughly 40 centigrade, are recorded at the height of a child's head at midday on some of these rubber tile fields. And then at the end of the life of the field, the rubber tires have to be disposed of as toxic waste, which is very expensive. So the town that that buys or the school district that buys the turf field, thinking that they're getting a bargain because they don't have to cut the grass every year, end up poisoning their children and then getting stuck for a big bill 10 or 15 years later when the field reaches the end of its natural life and the material has to be disposed of. It's a very bad deal. It's been heavily touted by the plastic industry. Typically, the way they operate is they line up a bunch of boosters, advocates in a particular town, and then those people noisily advocate for a plastic field for the student athletes, and then the taxpayers are stuck with the bill.
Oh, yeah. Not good. Thank you. Yeah. Well, so it looks like we've gotten a few questions, a lot of great statements and ideas and things. A couple questions and then some very specific about kind of bioplastics and that PLA, which is called compostable, is equally damaging to the environment and things along those lines. Could you talk about bioplastics a little bit, please?
Well, certainly there's a lot of energy and excitement about bioplastics, biodegradable plastics that go away and are not immortal in the oceans the way so many conventional plastics are. Um, I'm not a plastics chemist. I'm a medical doctor, so I don't want to get too deep into this one. But I guess I'd like to really see that these things actually do degrade in the environment. It's one thing for a chemical to degrade in the laboratory under carefully controlled conditions, but it can be a very different thing when that same chemical is out in the cold water, uh, somewhat protected from sunlight. It may have a very different life cycle. So I'm not saying that there's no hope there. I hope that there is, in fact, but it's like trust but verify.
Thank you. Yeah, no, I think, folks are asking a lot of very detailed questions and some specific things about, alternatives to films and those kinds of things that hopefully we can share some links in our follow-up email. And we have a lot of that kind of information. One easy question is, what would be your favorite article to share in addition to your report? Would you recommend for folks to read or that we can add to what we share with them?
Oh, that's a tough one. There's so much interesting stuff.
It's not
out
easy.
there.
Okay.
If I had to pick one, it's a bit dense. It's not the easiest reading in the world. It's a report that appeared in the Lancet about 4 years ago called the Lancet Commission on Planetary Health. And the concept is that we're all each and every one of us is part of a planetary ecosystem that includes all life on Earth. And that anything we do that damages the planet ultimately comes back to harm us, which I think we've certainly demonstrated. It's most obvious in the case of air pollution, but we're also demonstrating in the case of ocean pollution. And another point that report made, which I think is very interesting, and it really caused me to pause and really think rather deeply about some things. They introduced the phrase that I'd never really quite heard before, that what we are doing with our patterns of consumption in the world today is that we are mortgaging our future, or maybe not our personal future, but humanity's future, our children's future, our grandchildren's future. Because what we're doing is we're living in a world where the mantra is grow, 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 increase the economy, grow the GDP, the gross domestic product, from one year to the next. It's what some people have called a take, make, use, dispose economy, or another word that's used is a linear economy. In other words, stuff is used once, passes through and gets thrown away, doesn't get reused, doesn't get recycled. It's all the opposite of a circular economy, where to the extent possible things are reused, recycled, reincorporated into other materials. And in that Lancet Commission on Planetary Health, I think embodied some very profound thinking. A lot of it actually reflected the thought of a wonderful man who passed away a couple of years ago, Anthony McMichael, who was a leading Australian scientist who is maybe the seminal thinker in this area. So if somebody really wants to get deep into this material, I would suggest reading that.
Great, thank you. Well, and that just we are mortgaging our future concept makes me think also of there's a recently released Bankrolling plastic report that is all about the financing of this industry, and we may have a future webinar about that. I think it's a powerful topic and way to get involved. So just a couple other specific questions. I think we still have time for a couple more. Would you say, with all the health problems created by plastic and these chemicals, that it might be fair to suggest that that its production should be entirely stopped and that it would be considered a crime against nature?
Yeah, I have trouble advocating for an absolute ban on the production of all plastics. I don't know if the Plastic Pollution Coalition has a position on this, but I'm of the opinion that some forms of plastic are extremely helpful and they save lives. I'm thinking, for example, in the medical context, in the newborn nursery, right now there is simply no substitute for plastic for the little tubes that we put into babies' blood vessels or into their airways to keep them alive when they only weigh 2.5 pounds. There's just no getting around plastic for some applications like that, some surgical applications, some other medical applications. Once you get past a relatively small list, short list of truly essential, unavoidable uses of plastic, I think one rapidly realizes that most of the plastic that's made and used and discarded these days is for trivial purposes, like drinking straws, plastic bags, double wrapping of stuff that we used to just buy off the shelf unwrapped. And I think there's a very strong, very potent argument from both the perspective of human health, environmental health, and the economy that could be made for sharply, drastically reducing the production of plastics for those trivial uses. It's basically, in a lot of ways, it's a manufactured market. The industry comes up with these products and people grab them, and all of a sudden it becomes part of our lives willy-nilly. And that's just, it's wrong, it's unthinking, and it's ultimately dangerous.
Thank you. Yeah, we don't call for an outright ban, but we do and have since our creation, the Plastic Pollution has called for a refusal of single-use plastics. So
Yeah,
those ones that,
I would absolutely support that. And indeed we did support that in the Monaco Commission on Human Health and Ocean Pollution.
Okay, well, I think I have time for a few more questions. There are a couple folks calling for you to maybe go deeper on your nuclear power stance, but I don't know if you want to go into that, not being a nuclear scientist either.
Well, I'll just say one thing about that. I know that there's been a lot of talk about newer, safer reactors. And it's true that reactors are very safe most of the time. But there are two downsides to nuclear power. The first is they're not safe all the time. And in our lifetimes, we've had 3 Mile Island in Pennsylvania, which was a near miss, Chernobyl, which was not a miss at all, and Fukushima, which was not a miss at all. And when these things go up, the consequences are terrible. And the engineers will say we can build them better, safer, and no doubt they can. And they build them to 6 sigma and even to 8 sigma. But nothing is totally perfect in this world. So that's the first problem. The second problem is that no matter how safe the reactor is, the unavoidable consequence of using nuclear fuel to produce power is that you generate nuclear waste. And this stuff is immoral. This stuff lasts for centuries. And it's got to be put somewhere. And nobody wants it in their backyard. You can't dump it in the oceans because it will immediately be picked up in the marine food chain. So what are you going to do with it? It's the only way to prevent the production of nuclear waste is not to burn nuclear fuel in the first place.
Thank you. Yeah, and I mean, as we know from Fukushima, it is in the ocean, and there have been some questions about what fish is safe to eat, and then also, if you want to get pregnant, what to do to really help either detox or protect yourself, etc.
Good. I think that's a great question because the principle here is that not all fish are equal in terms of their pollution load. And as a general principle, the fish that are most heavily contaminated with mercury, with PCBs, with plastic, with anything that's in the ocean are the predatory fish, the carnivorous fish at the top of the food chain. Tuna, swordfish, striped bass, bluefish, other fish in other parts of the world. And the fish at the bottom of the food chain, the fish that basically eat plankton and vegetable matter, have far lower levels of toxic chemicals. And there are several very authoritative guides that have been published that you can carry in your pocket when you go to the store to or go online to tell you which fish to avoid and which not. NRDC, the Natural Resources Defense Council, has such a list. The Environmental Working Group and the Monterey Bay Aquarium in California has a great list that looks not only at the toxic loading in the fish, but also the sustainability of the different species of fish. What should somebody do if they're pregnant or thinking about getting pregnant? I would say, if it's a planned pregnancy, start watching what types of fish you eat as much as 6 to 12 months before you conceive the pregnancy, because these chemicals do wash out of the human body, but they don't wash out overnight. And if you start detoxing 6 months or a year before you get pregnant, your chemical load will be a lot lower. By the way, when I say detox, I do not mean chelation. Some people, get into chelation to try to wash chemicals out of their body. Very dangerous practice. I recommend chelation only be done if a physician is directing it. Don't go and buy chelating agents and try to do it yourself. If somebody already is pregnant, because we all know that not every pregnancy is planned, then immediately, just as you would no longer drink alcohol, no longer use recreational drugs, no longer smoke, also stop eating swordfish, tuna, other fish that are on the list as being high in pollutants.
Thank you. Okay, wow, we have like 50 something questions in here. And I know we've also just shared the link to the Plastic Pollution Coalition and Coalition member Made Safe recently released a healthy pregnancy guide, and it's very much a plastic-free pregnancy guide, and has great information for planned pregnancies and it just hopes of future healthy fertility information. And thank you for sharing all those other resources. I know EWG and I think NRDC and maybe even the Monterey Bay Aquariums, they used to be wallet cards, and a lot of them now actually I think have apps that you can download. EWG
That's
has.
right. There's also a nice little book out there
Oh,
that my wife and I wrote.
yes, I have that.
Uh,
Children and Environmental Toxins, What Everyone Needs to Know.
yeah.
And we can share a link to that as well. So some great info there. I think we are at time, but if there are some questions that we missed that we can share links to, or we'll share them with you afterwards, we'll make sure that we pass those along. We are so thankful for your time and for this great discussion. I hope we've also seen a lot of comments thanking us for this and really appreciating all the information. We have also a few links in here that will also be sharing this information for things that you can do to help refuse single-use plastic in your life, and ways to encourage other people to do the same, and ways to support reusable zero waste companies, and then also some policy actions and corporate accountability campaigns to hold governments and companies accountable to reduce their packaging. So we'll share all those links with folks. And then we also want to make sure to invite everyone here to participate, if you can, in our next month's webinar with your colleague Shauna Swan and Dr. Pete Myers. And they will be talking about, will humanity survive plastic pollution, and specifically the toxic impacts of plastics chemicals on fertility, which we touched on a little bit today. They will dive deep, and Shauna has her book coming out about countdown in sperm count. So we invite you all to register for that, February 24th, 2 p.m. Pacific time, 5 p.m. Eastern. And we invite you to join us. It is free to join the Plastic Pollution Coalition. If you're not already an individual, organizational, or business member, sign up and follow us on social and all those fun things. I think we have all of that here too. And we look forward to seeing you again. Thank you again, Phil. So grateful.
Thank you, Julia. It was a pleasure. And thanks everybody who joined the webinar this evening.
Yes, thank you all for joining. Thank you to the whole Plastic Pollution Coalition team who helped facilitate all this on the back end and organize it on the front end. And we will see you next month. Thank you all so much. Be well, be safe, be healthy.